Hello viewers and learners, welcome back to this important session on research process. We will focus on B.Sc Nursing Post Basic third year program, and the course for discussion is BNS-111, which is Introduction to Nursing Research. This is related to the block 3. We will be focusing on unit 1, which talks about research and research process. As a post-basic B.Sc nursing student, you are a beginner researcher and you have to be very well acquainted with various terminologies which are related to the nursing research. You should not think that the research is a gigantic term or it's not your cup of tea. You must realize that in your all day-to-day activities which you are performing, whether in the wards, whether in the college or whether in community, you are doing the research. The fact of the matter is that you have to organize the thinking, what you are doing, and then put them together, synthesize them, and when you organize them and synthesize them, that becomes the research. So all of us who are involved in the activities are doing some of the other research. Some do it in an innovative way, some do it in a descriptive way, and some do it in an exploratory way, and some do it in experimentation way. The aim is that we are doing the work. When we are taking care of the patients, what are you doing? You are assisting the patient to get recovery from the disease, for the prognosis, and in the process what you do, you record that how many patients of such disease had come. You record that how many times this patient has come for hospitalization. You record what is the background of the patient. You record what is the socio-economic status of the patient. And you record what are the signs and symptoms of the patient, what treatment strategies have been given to the patient. Similarly, in the classroom, what you have learned, how you have learned, and who has taught you. So all these ideas and all these activities, when organized in a systematic way and synthesized, it becomes a research. And so nothing to worry about that you do not know research. You are doing every day to day, but only some thinking process is required. So having said that, for this topic we have Dr. Poonam Joshi from AIIMS College of Nursing. Before I request her to deliberate on topic in detail, I would just give a brief about what we mean by research, because sometimes we feel that research, as I was earlier telling, that is a gigantic term. It's not. It's a very simple term. Research means whatever is already existing, we are trying to find out what exists in different situations and with different setups, different population, different sample, and all those things. Because whatever thing that exists already in the literature, that exists in the environment, and that exists in our surroundings. So research is a systematic and scientific investigation or search to a question about any fact. As I was talking, you are doing many activities. So you are finding scientifically you are finding an answer to a question about the facts, and also you are trying to find out the relationship between the facts. So it is nothing, just a simple scientific and systematic investigation where you want to find answer to a question. Your question could be anything. Your question would be that why a patient A is behaving differently than a patient B, why a patient C recovers more early than the other patients with a similar problem. So these are the questions. So you want to find answer to this why it happens, why this patient is again and again hospitalized, why this patient has such type of problem and the other patient of similar nature does not have this problem. So you are giving answer, you are putting a question to yourself, and then you are trying to find answer systematically and empirically. You don't have to find an answer like this, that this is because of this, this is because of this. No, you have to find the answer very systematically and scientifically and empirically. That is very important. Scientific, systematic and empirical. When we talk of scientific, it means that it is verifiable. When you say anything is scientific, that means it is verifiable. You can verify the things, and then you can say that this is a scientific. And when you talk about the systematic, you mean that you follow a very predetermined steps to find answer to your question. You have asked a question to yourself which is verifiable, and you are trying to find out answer to this particular question by using predetermined proper procedural steps. That is systematic. And then it is empirical. You can observe the results by your senses, touch, taste, eyesight, everything. That means it is empirical in nature, that you can verify and observe and measure the results with the use of your senses. So this is what is basically the research. And then research you can control, so because if you want to find out what is the relationship of diet on hypertension or diabetes or anything, so there may be other factors which will affect the finding out of effect of diet, so you control that. And then sometimes you can generalize the results if you have a large sample which is reliable tools, everything, so that is generalizable. And why do you want to do the research? Because your nursing research basically includes more important things: critical, empirical, systematic, scientific analysis or investigation of the answer to a particular question. And then with this investigation you are trying to add to the knowledge of nursing, you are trying to add to the practice, you are trying to verify the practice and see how reliable is the nursing research and how it can be applied into the practice, and also how after its reliability in terms of the practice and knowledge, how it can be applied in improvement of the patient care. So the main purpose of this research could be basically describe. There are some researches where you only want to describe, that you want to see, suppose there is a family planning methods, you are using different types of family planning methods on the patients, not post-gravid mothers. So you are just want to decide what is their opinion about these different types of, which type of family planning method they are using. So that means you are only describing what is their opinion about different types of family planning methods which they are using. But then if you just go further, that this means description, research is meaning description. Then if you want to go further, you want to explore. And when you want to explore that, what are the different factors which affect the opinion of the post-gravid mothers regarding the various types of family planning methods. That means here you are finding the relationships. You are identifying certain factors, and those factors you are making a relationship with the results, what they are, with their opinion. So that means you are exploring. So this is one of the important purpose of the research: description, exploration, and then you are predicting. You predict certain relationships between the two. You say if elderly mothers, who are pregnant, and if the baby with Down syndrome is more prevalent in the mothers who are elderly than the mothers who are younger. So this is a presumption, this is a prediction which is already made. This is a hypothesis, this is a prediction. But when you want to find out whether this is true by doing the research, that means the research, this is the purpose of research, prediction. That means we predict the relationship, and then we test it whether by doing the research, by doing the investigation, then we try to find it, yes, this is a research. Then so we have said that the important things of purpose of research is that you have to describe, description, exploration and prediction. So with these few words on research, I would request Dr. Poonam Joshi to talk about what is the research process and what are the steps of research process.
Thank you, Dr. Pittikal, for having explained such nicely about the research in a very, very simple manner, so that our students, our audience could get an idea of research. As you have very rightly said, it is a very systematic and a scientific approach where we are trying to look for something which is not yet known. Though the facts are there with us, but still we would like to generate the evidence. It is said that research always starts with a question and it ends with the generation of an answer. So in research process, what do? It's a process which is going on continuously, and in order to understand research process, we need to break research process into two words, that is research and process. So let us see one by one what are these, so that the combination of research process can be made clearer to us. Research, as it is being described by Lancaster in the year 1982, it says it's a planned, systematic search for information for the purpose of increasing the body of knowledge of an individual. So the main purpose is to generate the knowledge, to increase the body of knowledge, which is likely to be a foundation for any profession. It involves for looking for information which at times is not available. It might be available somewhere, but it's hidden, it's not known to us, or for which there are no substantial evidences available. So this is a very beautiful definition given by Arthur Lancaster in the year 1982. We have similarly beautiful definition given by Curlinger in the year 1986. According to this definition, it is a systematic, controlled, empirical and critical investigation. So please pay attention to the words which have been very carefully selected in this definition. One is, it's systematic. You are going in a very gradual manner, in a systematic manner, in a controlled manner where the things are under your control. And it's empirical. As you have said, empirical means it is evidence based. We are trying to generate the evidence so as to say that this is empirical, and it also involving critical thinking. So research process can never be done overnight. It has to be done over a period of time. So one has to continuously work on it so as to generate substantial evidence for our profession so that the professional status could be upgraded. So in this, what we are doing the critical investigation of any natural phenomena which is guided by the theories, hypothesis about the presumed relationship among such phenomena. Now next is the process. Process, we all know there are interconnected steps. There might be some kind of overlapping, but they are well defined steps which are putting you into action. So it's a course of action or proceeding which can be followed for doing something. So research process, it's a systematic process, it's a scientific process, and it is aiming towards increasing the body of knowledge. Now let us see, there are few basic steps involved in any research. Whenever we are conducting any research, we have to keep in mind few fundamental steps in our mind. The one is, we start always with planning. The second step is the implementation part, and third is the communication of the findings and applying the results into our practice. You already know that research can be divided into two. It can be a basic research, can be an applied research. Applied means it is action oriented. Like you came across a problem in your unit. While working in your unit, you observed that there was lot of use of mobile phone going on in your unit, which you wanted to minimize. So this is the problem you identified and you are taking action. So it's an action oriented research. You are planning to take some actions. You may be in the form of a quality improvement initiative so as to improve the patient care services. So your research can be a basic research. The purpose of basic research is to make person known about the facts. And the applied research is always action oriented, which is going to yield good results and is going to improve the profession. In some books, in some literature, you will find conceptualization as a separate step from planning. But most of the books describe three important steps, that is planning, implementation, communicating, and then applying the results into real practice. Now, how does research help us? It contributes to our profession in number of ways. As we have been repeatedly saying, it is helping us to generate the body of knowledge so as to improve the standard of nursing and so as to provide high quality individualized patient care. How do we select a problem? Problem selection also comes from our experience. from our day-to-day problems. So the most important contribution of research is to acquire knowledge, to build a theory base. Already a theory is there, you are trying to explain that theory with the help of your findings. Similarly, we are validating the results, reality, sometimes we are testing the reality. Here I would like to give you an example, like simulation is found to be an important way of teaching. It's considered to be a new technique of teaching. It's better than the conventional method. If you want to see the efficacy of simulation, you have to test it. Though it's a reality, but you need to test it, you need to bring about the results so that it is acceptable to majority of people. So one of the contribution to research is, of the research to the education is to test the reality. It's a way of understanding the empirical world and to test, confirm or refute the already established facts. So here we are talking about different stages. As I said earlier, there are 3 stages. The most important stage is the planning phase, where we start with the conceptualization of research problem. This includes stating problem, defining purposes, then defining the key terms. You identify key terms in the problem and you try to operationally define them in your work, and then comes the related review of literature, followed by development of conceptual framework, then identifying assumptions, defining variables and stating hypothesis. Then there are few more steps involved in the planning, that is, you are deciding research design, you are selecting an appropriate approach. Approach could be a quantitative approach or a qualitative approach. Then you are deciding how I am going to do the data collection. All these things we are going to discuss in detail in the subsequent slides, and then making a plan for data collection, followed by deciding the population, the sample, and how I am planning to select those samples, and then plan for data analysis and data interpretation. Then comes the phase of implementation. This is the actual action phase, where you are going for a process of data collection. You are having some tools and techniques available so as to collect the appropriate data required for your research activity. This is followed by analysis, and then we have the interpretation of the results, and then once the implementation part is over, next comes the communication. Communication is also considered to be an important component, the most important component. Your valuable research should be made known to the people around you. The fraternity, the nursing faculty should be aware of the findings. So that needs to be properly communicated. You can communicate in number of ways. You can make a paper presentation, you can make a poster presentation, or sometimes publication, like putting it in a form of a writing. You get it published in any of the reputed journals. That is another way of dissemination of information. Now again we come back to the 7 steps of research process. So the step 1 is defining the research problem. Second is reviewing the literature, formulating the hypothesis, preparing the research design, data collection, doing data analysis and interpretation, and report writing. This diagram is showing the steps which are interconnected and related to each other. Then let's start discussing about research problem. How do we identify a research problem? Research problem can be identified from 2 sources. You can have a clinical source, you can have a knowledge source. Like while working in a clinical area, you came across problem of mobile phone use, as I said earlier. Similarly, you can have high infection rate in your unit, or you are observing sudden outbreak of infection in your unit, or you find absenteeism is becoming a problem in your unit. So these are the problems which you are identifying from your experience. There was a time before we had research well established, we were depending upon unstructured methods like intuition, our past experiences, and then the trial and error method we use. But now with the help of research, we are able to perform the activities in a very systematic manner. So the first step includes the identification of problem, on the basis of which we decide the research question. So one source is going to be the clinical source, other could be your knowledge which you gain while attending any conference or while attending any educational meeting, or going through the review articles or the journals that help you to get acquainted with the new things coming up, which you would like to try, which you like to test in your own setting. As we had said earlier, the purpose of research is to define, to explain, to explore, and to predict the relationship between the two variables. So here we have the research problem where we have four important components, that is patient population, interest, comparison, and the outcome. This PICO format we need to always keep in mind. Any problem you have, just keep in mind these four important components. Then we have second step related to the review of literature. Review of literature is again considered to be an ongoing process. We have to look for the relevant related reviews. And remember, these are to be latest ones. Don't go for old literatures which may have become now obsolete. So preferably literature of 5 years or old is sufficient enough. In the case of paucity, you can extend your years by another 5 years.
Very important to know how to search the literature. It's a very important activity for a researcher to understand what is really how you can search, because there are so many search engines and all that. Now so many databases are there and you have to be aware of. But at this level, I think you may you are a beginning researcher and you must not go into that depth, but at least you should be able to understand what are the journals, what are the articles, what are the books, and what are the different databases available where from we can have the review of literature, which will give you insight of your problem. More you have to conceptualize the problem, which will give insight. So we have discussed very important three areas. In the phases, we can say in the phases of research, we can also say in the stages of research, and those phases were very important: the planning phase, the implementation phase, the communication phase, and also the applying phase, applying of the results. If we talk about the planning phase will include all the activities as has been discussed. You have to identify the problem, you have to conceptualize it, then you have to review the literature, you have to find the design, population, so all other things, validity of the tool, identification of the different types of the tools, research design, research approach, research methodology, that all will come into the planning stage. And if you go to the implementation stage, in implementation you have collection of the data, you have identified the tool in planning stage, and then with the help of that tool you will collect the data and also analyze the data by using inferential and descriptive statistics depending upon the objectives of your study. And finally you are going to write report, which is the communicative phase or phase of application of the results. So when you do some research, it has to be communicated. People should know that what research you have done, and there are different ways of doing the communicating the research. One of the important thing is the requirement of your master's or doctoral degree, that is writing of dissertation. The other important thing is that writing the monographs, publishing the articles in the journals, and writing book chapters and all that. That is very important. Thank you very much.